morning. Welcome back to Atlanta & Company. I'm Christine Pilara, so happy to be with you today. Hey, are you tired of having tired and achy legs? Are those unsightly veins causing you to wear pants in the middle of summer? It is a problem for both men and women, but something can be done about it. Thanks to VEINatlanta. Here to tell us more is Marketing Director Keisha Turner and patient Brenda Lay. Good morning to you both. Thanks for being here.
Good morning.
I'm one of those people, I have those spider veins. Hopefully it's not getting worse with the varicose just yet.
Yeah.
But let's talk, Brenda, I want to address you. How did you first start noticing that you were really having problems with your legs? What were the symptoms?
Well, my legs were tired and feeling numb and just restless legs. And I could see the spider veins in my legs, but they
Sure.
wasn't bad at first. And, you know, they progressed later, but it was just tired legs.
Right. It wasn't so much just that they were unsightly. It physically really hurt.
Yeah, they actually hurt, but they were unsightly also.
Yeah, I know. Listen, I know. I'm getting a feel. I've had a patch since 7th grade. Listen, it's like, what? But it's hereditary, which we'll get to in a minute. So when did the symptoms become worse? Has it been just a gradual thing, or suddenly did you feel like it was an onslaught?
No, it was more gradual. It was more gradual. They, you know, you could see, like I said, you could see them slightly like in the back of your legs, and then lately they start coming to the front and on your thighs and stuff. So they get worse, definitely get worse.
And Keisha, what are common signs, symptoms? She's mentioned a few, but tell us more. We might have people out there that are thinking, wait a minute, this is me.
In addition to the tired, achy legs, patients can also experience heaviness in their legs. They can experience cramping, as she mentioned, restless legs, swelling in your legs and your ankles, even skin changes and skin ulcers. And a lot of times the patients do not realize that their symptoms can come from chronic venous insufficiency, which we've discussed on previous episodes, and they don't do anything about it. Other times they think that their issues are just simply cosmetic or that insurance will not cover it, but the reality is insurance will cover it, and we are in network with most insurance providers, including Medicare.
And just go back a minute, you mentioned the venous insufficiency disease. And talk about how that is. It's a really simple procedure. I had it done to figure out what my issues are. It's nothing. If you've had a baby, then you're going to feel it's just like that, right? Like the sonogram.
Exactly. Venous insufficiency is the underlying issue that causes the varicose veins. And what happens is you have one-way valves in your legs, and once these one-way valves become dilated or leaky, it causes reflux. And it causes pulling in your legs, which causes some of those skin changes that I talked about.
Right.
And that's what we fix. That's what we treat.
Okay, and let's talk about it, Brenda, because I know that you're a corrections officer. So were you standing for years? I mean, that had to really impact your job.
Right. I was a correction officer for 22 and a half years, and basically we stood on the cement floors and a lot of standing, and you know, your legs would just ache. When you go home, you're just aching and hurting. And I went to a doctor before, Dr. Prevosti, and he said that your legs, varicose veins doesn't make your legs hurt, but be advised, it makes your legs hurt.
Right, right. Well, you can't help the way you feel. You know, and it's standing is something that's very common. And my mom's a teacher, and her unfortunately her legs scare the heck out of me because she needs to see Dr. Prevosti, but she lives in Tampa. Next time she's here, I'm serious because it's bad. And she, as a teacher, think of all the professions. You're standing, your blood's rushing down. I mean, you know, there's other symptoms as well, or other you know, risk factors. So talk more about those.
Other risk factors include family history. If one of your parents had varicose veins, there's a 50% chance of developing it. If both parents had it, it's even greater risk, an 80% to 90% chance. Gender also plays a role in that, as we've stated before, women are more prone to getting the disease. However, men can get it as well. Age plays a fact. As you get older, the more apparent your problems become. And pregnancy is another issue. You have increased levels of progesterone, and that puts pressure on your valves.
And Brenda, how did Dr. Prevosti help? Because you mentioned you saw other doctors, so clearly they didn't help you that much. They weren't very effective. So what made you decide to go see him?
Well, I was looking at the Atlanta magazine, and I was always thinking about the varicose veins in my legs, and I saw Dr. Prevosti's ad, and I was looking at his profile, And after reading his profile, I said, this sounds like this should be the doctor for me.
Right. He knows a thing or two about treating veins.
Yeah,
Great. Many years of experience.
Exactly.
Right. So I called in and made an appointment, and they gave me a free consultation. And I went in, and he did the ultrasounds and everything, and told me exactly what would need to be done. And everybody, the office people, Dr. Prevosti and everybody was very professional and very nice and courteous. And I thought I would go with him because I thought he seemed like, and I also looked him up on the internet and checked his rating out, and he had a 4- and 5-star rating.
Fantastic.
And I thought that he would be just a doctor for me.
Yeah, he is. He's incredible. And let's talk about, Keisha, why he is Atlanta's vein doctor. Because he's really, it's the last stop. It's like the holy grail for people who have literally been searching for solutions. I hear so many clients and patients come on, say, we went elsewhere. Nobody helped me the way that he did. So what makes him so unique in this field?
Well, he was a cardiovascular surgeon for more than 20 years. So that definitely makes him stand apart from his competitors. He also owns and operates the practice, so you're going to get his undivided attention. He devotes 100% of his time to only doing vein work. He doesn't do anything else on the side. All of our procedures are done in the office, very minimally invasive, under local anesthesia, and we offer every treatment possible to treat your varicose and spider veins. In addition to that, Dr. Prevosti is very passionate about what he does, and I think that's very important because when you're passionate and you care about what you do, it shows in your work.
Absolutely.
And I definitely think that the patients can see that when they come to see him.
Got a great bedside manner, which is important. To make you feel comfortable and make you feel like you have found the right place. How are you feeling now?
I'm feeling fine now. My legs are a lot better.
Good.
They feel better. They look better.
You were sporting some skirts this summer without feeling bad about it, right? I know.
So they are a lot better. And like Keisha was saying, Dr. Prevosti makes sure that you are very comfortable. He has very good bedside manners. When he's doing his procedures, he'll be like, 1, 2, 3, stick, it's over there. And most of the procedures take only about 30 minutes, and you can go right on to your regular activities.
Sure, that's fantastic.
So he's very good.
Lots of different options, and of course you can always call the number on your screen or go to their website to learn more information. Thank you both for being here, Brenda. Thank you. So glad you're feeling better. That's what's important. And for more information, call 404-446-2800 or visit their website. It's VEINatlanta.com.